Hello dear friends, welcome to this video. This is Coach FO. My name is Fehintola Onagoruwa, and today we will be looking at an ailment called arthritis. I'm sure you've heard that before. In fact, this morning I met two new friends, and surprisingly their mothers are with them suffering from arthritis. Do you know anybody who is going through the pain of arthritis? We will be able to help them, and that's why we have brought to you this so much information so that you can also relate it to them and begin to guide them, because we're looking at the natural ways to prevent and manage arthritis. And why is arthritis so common? It occurs particularly to women. As we age, there is a challenge. During childbirth, the children takes our calcium, and the body does not reproduce calcium by itself, yet the bone needs calcium. So what happens? The brain uses the calcium remaining in our bones. So after menopause, most women have depletion of calcium in their system, and because the body does not produce, arthritis easily sets in because the bones are weak for lack of calcium. That's the first hint I want to give you. So for every adult woman around you, especially once they are over 50, please pass this information across to them so that you will help them more, so that they won't become bent and so that they won't find it difficult to work, because the knee joint is majorly affected. So let's go. What exactly is arthritis? Arthritis occurs as a pain or inflammation and or a wearing away of the joints. It's two types. I'll go into that. But arthritis is when the joint becomes unhealthy. How do you picture a healthy joint? When you have a healthy joint, a joint is a place where two or more bones meet. That's the simple definition of a joint. Every part of your body that you can flex and extend, that you can curve, means two or more bones have come together there. Now, there's a normal joint health. How do you mean? Any part of the body where two or more bones meet, one, there is a ligament holding the two bones together on this side and on this side. Two, there is what we call the cartilage. If you are eating bone, there's this whitish substance that you can use your teeth to scrape. It's called the cartilage. The cartilage is the shock absorber at the joint. That is what helps us to prevent friction. Manage pain when the two bones glide against each other. So the cartilage is there. Thirdly, there's a fluid called the synovial fluid. The synovial fluid is the lubricant. It helps to lubricate the joint. So all of these are natural at the joint. But as we age, there is wear and tear. One, the ligament begins to wear off. Two, the cartilage also begins to wear off with age. Do you know how many times we move our joints every day? Thirdly, the synovial fluid dries up. This synovial fluid contains what we call chondroitin sulfate and glucosamine sulfate. Those two are very important, naturally occurring, chemicals, things at the joint. The way God has designed the joint, it has normal health. But as we age and we are not, maintaining this normal health, how? We overuse without managing the repairs. Two, as the synovial fluid dries up, we are not replenishing the naturally occurring substances at the joints. 3, the weight of the body rests especially on the knees. So the knees begin to buckle under the weight. So those are the things that happens at the joint. So with age and with all this abuse of the body, abuse simply means abnormal use of the body, because when we're not cognizant of how we should maintain our health, then we abuse the health. So with all of this happening, and most importantly, by eating things that when stored at the joints can cause damage. For example, red meat. Imagine how much of that we've eaten as we were growing up. Because when you eat red meat, it takes an average of 1 week to digest in your system. And so the gut, that's the digestive tract, absorb a lot of cholesterol from bad fat and from meat. So these cholesterols are deposited in the blood vessels, leading to high blood pressure, and at the joints, leading to arthritis. So those are the ways we have abused the body as we grow. So I want you to understand, I've used that to explain to you some of the things that can likely cause arthritis. What are the symptoms that you begin to experience? 1, inflammation and pain in the joints, usually beginning, in the hands or feet, but can also occur in the spinal column or in other areas. That's why you begin to see people bending over, because the spinal column is being affected. Humid climate and cold weather increase the pain. Remember I said there is fat deposits, and with cold they are very thick. It can become difficult to move and also can cause a deformation in the affected area of the body, like the hands, the joints in the hands and the feet. It generally increases with time, impeding freedom of movement. So you find a lot of our elderly women suffer because moving from one point to the other, even within the house, can become very painful. And I tell you, the pain from the joints, the pain from the bones are very, very painful, are very bad. So we want to review that. Let me explain to you the difference between these two types of arthritis. There is what we call the osteoarthritis, and there is the rheumatoid arthritis. The osteoarthritis is a deformation produced when the cartilage between the bones wears away. I told you that earlier, to the point where the cartilage can disappear, causing the bones to rub up against one another, particularly in the extremities. What do we call extremities? The hands, that's the fingers, and the toes, particularly in the extremities. So that's how you know the osteoarthritis, the legs and the hands. That's where you find osteoarthritis more. Osteoarthritis caused by the wear and tear of cartilage usually affects people after age 40, affects isolated joints or joints on only one side of the body at first, causes discomfort in the joints, but does not usually cause swelling. Particularly affects the weight-bearing joints like the hips and the knees. Remember I spoke about that. Does not usually cause fatigue, but causes brief morning stiffness when the person just wakes up. The second type of arthritis is the rheumatoid arthritis, which is different from osteo in that it extends to the whole body, inflames the cartilage and synovial membrane. Remember I mentioned the synovial fluid where the bones join. This causes a loss of synovial fluid. That's the oily liquid that serves to lubricate and protects against friction and deterioration away of the bones. This illness is not common, but when it occurs, it requires medical attention. That's the rheumatoid arthritis. So the rheumatoid is an autoimmune disease that often afflicts those from ages 25 to 50. So it happens more in younger people. Usually occurs in younger adults, but it can attack children, even infants. Usually affects joints on both sides of the body, like both knees. Causes redness, warmth, and swelling of many joints, and attacks many joints, often the small joints of the hands. So when you find swelling in between the joints of the fingers, feet, ankles, knees, and elbows. Causes major fatigue of the whole body. Causes prolonged morning stiffness. These are some of the causes and some of the symptoms that one will experience with arthritis. We need to know this, and then if you begin to see all these signs, please go to the hospital for proper diagnosis, so that means you already have it. If you don't have it yet, then we're looking at the ways to prevent having that, and that we will be talking about in our next video, which will be the part 2 of this video. If you are yet to subscribe to our channel, please press the subscribe button. I'm sure you're getting value. Share our videos with your friends, and then more will also come your way, and learn more, so that prevention is better than cure. Thank you very much, and have a great day.